With uncanny regularity, I have seen that for the last 18 years that I have been in the practice of hair transplant surgery, every year 1 or 2 patients will bang their head against the door of the car while talking to the driver while getting in. So this video is in response to a question on my YouTube channel. Doctor, till when are my grafts not secure? Well, definitely they are not secure on the first day of the procedure. The clot has not yet formed fully. Innocuous procedures like coughing too much, talking too much, making too much facial expressions, especially when the hairline has been done with high density, the temples have been restored, chewing on hard food can dislodge grafts. Grafts can also be dislodged by spraying saline very vigorously from close by. When you spray saline, you should be spraying it from an arm's length away, not up close with the grafts. So these are the ways in which in the first 12 hours the grafts can easily come off, because the clot that forms is a very loose clot. It takes up to 12 hours for the clot to be firm enough. But even then the grafts can come off. If you hit your head while getting into a low door, while getting into a car, if you are not careful at night while sleeping and you rub your head, the planted area against the bed sheets, the pillow cover, grafts can easily come off. And of course, if you're a deep sleeper, you can pick on the grafts at night, oblivious of the fact that you're doing it, and the grafts will come off. The sure shot sign that a graft has come out is active bleeding from a spot. This means that the graft is out. And the graft that has come out should not be put in because it gets infected, because it is not in a sterile condition. So grafts that come out cannot be placed back once they're out traumatically. So how do you ensure that you do not lose your grafts in the first 5 days, after which they are quite secure, and even the surgeon who wishes to take out the grafts cannot do so because they're one with the body? Grafts get consolidated with the body on the 6th day after surgery. After 6th day, when hair comes out, they're not coming out with the root. The root is inside, deep down in the skin. The root will grow a new hair, and shedding will continue till 4 weeks. So the ways to ensure that you don't lose your grafts is, on the first day, to take it easy. Do not talk much. Don't spray saline from up close. Do not chew on hard food, especially if the temple points have been restored. Do not make very active facial expressions. Try to stay away from your phone. Sleep in the upright position, that is leaning back 60 degrees. And stay away from friends and family, and of course your pets and young babies at home. The next day is a whole lot different. If you bang your head the next day, very few grafts will come off. On the first day, if you bang your head, hundreds of grafts will come off, and they just cannot be placed back. If you call the clinic, if there's an emergency that the grafts have come off, the only thing that a surgeon will tell you is to put gauze on your planted area that's bleeding and hold it for 5 minutes till the bleeding stops. There's nothing much that even the surgeon can do at this stage. The grafts cannot be put back, as I said earlier. On the second day onwards, when you bang your head against a hard object, a few grafts will come off, 10 to 15, or 1 or 2 grafts will come off. The chances of grafts coming off after the 3rd day are less, unless the hit is pretty hard. 5th day onwards, grafts do not come out. 6th day onwards, even if the surgeon wishes, he cannot remove any graft. So that is it. The grafts are completely secure by the 7th day after the hair transplant. You need not worry about the grafts coming off. Yes, shedding is another story which we'll cover in another video. Thank you for watching. If you have any questions, any doubts that come to your mind about hair transplant, hair loss, do let me know and I'll be happy to help you. Have a nice day.